Hello and good afternoon, everyone. Welcome to episode 4 of Metamorphosis Medcast presented by DMC Club UK. Thanks to them and special thanks to Dr. Atikur Rahman for organizing all of it. And welcome to you all on this beautiful Saturday afternoon in the UK. Today with us, we have two incredibly brilliant doctors who recently secured SC4 positions into very sought-after medical specialities. Before that, let me introduce myself. I'm Dr. Ima Islam, currently working as a clinical fellow at Cambridge University Hospitals and an undergraduate clinical supervisor for the School of Medicine at University of Cambridge. With us, we have Dr. Mohammed Selim Reza, who is an ST4 in General Medicine and Stroke in Oxford Thames Valley Deanery, and Dr. Nawrin Ferdous, ST4 in Acute Internal Medicine in East Midlands South. Congratulations to both of you and a very warm welcome to today's session.
Thank you.
Thank you. Thanks for the warm welcome.
You're most welcome again. And thanks to our guests who are joining here on live on Zoom, and also who are watching or will be watching on Facebook and YouTube. If you wouldn't mind just dropping in on the chat where you're listening to us from, where you're joining in from, that would be wonderful. And maybe we can get some very useful tips and tricks cater to your specific situation if we have time. So that's just know where you are from, a quick introduction. And in the meantime, let's get a bit more acquainted with our guests. Let's go to Dr. Nawrin Pinky first. Hello, if you could just introduce yourself very briefly to us, please.
Sure. I'm Dr. Nawrin Ferdous Pinky. I am from DMC K66, and I started working in NHS in 2023, July, and started training in February on this year.
Amazing, wonderful. And then Dr. Mohammed Selim Reza.
So I would prefer you to call me as Selim. So that's my preferred name. Currently, I'm working in Oxford University Hospital, NHS Trust in John Radcliffe Hospital. I've recently joined in ST4 training in general medicine and a stroke, and currently working there from February 2025. I graduated from Dhaka Medical College in 2018 and completed my internship in 2019. Came to UK in May 2022, and since then I've been working in NHS and recently joined in 2025 as ST4 training. Thank you.
Amazing. Thank you so much, both of you, and congratulations. So we can't wait to hear about your incredible journeys. Just starting with why you chose your respective specialities, especially in the UK, because both of you, just for those who don't know, so they are both the seniors from my medical college, so same alumni. So it will be interesting to know why they chose their specific specialities and how that might compare to their experience back home for international medical graduates. Yeah. If we go to, again, Dr. Pinky first.
Right, okay. The reason I chose acute internal medicine as my specialty is, I would say the first reason is passion. When I first came to UK, I started working in geriatrics. I worked there for 5 or 6 months. Then I started working in acute internal medicine. And when I started working, I really liked the nature of this specialty. It is very fast paced, and we get to treat patients in first hand and get to see their recovery, which is amazing. It gives me immense satisfaction, to be honest, to see the result firsthand. So that was my first reason, passion, because I really liked it. And the second reason, I would say that the job market for acute internal medicine in UK is promising compared to other subspecialty. The AIM or acute internal medicine job prospect is quite promising because like if wherever you go, you will have a lot of consultant posts in acute internal medicine compared to other specialties. So that was the other reason.
Wow, that's fantastic. So whoever is closer to their ST3, ST4 application game at the moment, this is something, and if you do not have any, passion towards any particular speciality, this might be a very good inside information to consider if you're still struggling or you want to keep your options open. So yeah, thank you so much. So Selim, what about you?
All right. First of all, I'd like to congratulate Nawrin Apu. She is my senior from my medical college. I forgot to congratulate.
Congrats to you as well.
So, in contrast to Nawrin Apu, I like a bit slow-paced medicine. So, since I came into the UK, so my choice of a specialty was geriatric medicine, to be honest. But as part of geriatric medicine rotation as a trustwood registrar, I had the opportunity to work in the stroke. And I actually saw that stroke physicians are completely different from general medicine and acute medicine. Although in some parts, they actually do the general medicine round and acute medicine rounds. But most of the time, they are like separated from these two. So the good thing is that they only focus on the stroke. And what I like is I just need to focus very limited disease. If I focus too many, then that's a problem for me. So I wanted to be focused only one. Now, it's a part of geriatric medicine, and that's why I basically chose stroke as my main specialty. But you can't really enter into a stroke training only. So you either need to do general medicine, acute medicine, or geriatric medicine, or neurology, whatever the specialty is. Now, the reason I choose for this specialty, this is an accelerated stroke pathway, and this training program is only 3 years. So even if you complete the 3 years training, you will get a CCT. So that's why basically I didn't go for the full geriatric medicine rotation, and I chose the general medicine and stroke training pathway. The last reason is there is an talk of opportunity going for the mechanical thrombectomy for the stroke physician, although it's not very established yet. It's still being done by the interventional neuroradiologist, but hopefully at some point in the future we can apply for those posts. But yeah, it's very difficult to say at the point, but that's also one of my reason for the interest. Thanks.
Brilliant. Yeah. So from both of them, we've learned some sort of, as for those who are not super familiar with higher specialty training, you could say this is insider information, sort of, that there's like a shorter pathway and then there's like maximum chance, or compared to others, more chances to get into a certain specialty and become a consultant quickly. So thank you so much for sharing that with us. The next question would be how you entered the specialty training. So I suppose for both of you, you entered ST4 directly without going through IMT. Is that right?
Yeah.
Okay, all right. And then for the both of you, at the point of your career at which you entered ST4 is a bit different. So if you wouldn't mind walking through your journey individually and how you built your portfolio for your specialty or specialty application, that would be great to hear. So again, back to Dr. Pinky.
Okay. So before anyone can apply ST4, we have to have the alternative competency form signed. So this is actually can be quite challenging if we don't plan early. So if you're looking forward to get that signed, you'd have to plan early and plan effectively. So I can give you my experience, what I did, so who are listening can get benefited. What I did was, when I started working in acute internal medicine, my aim was to start higher specialty training as soon as possible. So to achieve that, the first thing I did was to have a meeting with my clinical supervisor. And I specifically asked him that is my aim. I want to get my alternative competency form signed. What do you need from me? What should I do? what are the checklist? Could you please provide me that? And could you have a timeline, suppose 3 months or 6 months? And I will achieve that within that timeline. And then we can talk about, we have another meeting and can talk about having a competency from site. So with that clarity in our mind, he gave me a checklist and which correspond actually to the IMT3 level. So I actually completed all the procedures that need to be signed, all the DOPS or MSF that, those are short term. Those basically means certain type of assessment form. So I did all of that, and after a certain period of time, 3 months, actually had again a meeting with him, and then I got it signed. But that was after while I was working in there. But before I came in UK, I had my master's degree done in neuroscience from Canada. So that helped me in gaining point when for the point that needed to apply for higher specialty training. So that's one thing, masters. The second thing is having the MRCP done. So that's the important bit, and the other bits are getting audits done. Audits are very important. I didn't had audits before I started working in NHS, of course, but while I started working in here, I planned early, and I led one audit for myself, which was as the leader, and I also led a national SAMBA audit, which is a national audit for acute internal medicine, before I even applied for the internal medicine program. So that was the things that I have done to have my alternative competency form signed off, and then with these points apply for the higher specialty training done. I hope that summarized that.
Yeah, you summarize it beautifully. Thank you. Moving back to Selim. So I think I don't know if you chose the same pathway. So did you also complete MRCP and then come to the UK, or was it through PLAB route? And how would your experience compare to Dr. Pinky's experience?
Okay, in terms of coming to UK, I didn't follow the PLAB route. Even I didn't follow the MRCP route either. I didn't follow the MTI route. So my route was completely different. It was a sponsorship route from the trust. Not all the people in UK or those who are actually planning to come to the UK are not familiar with this route. So first, I'd like to tell a little about that route, because it will take more time if I'm going to explain the full route. It's like there are a few posts that will be advertised in the track. They don't actually require any GMC registration. Nowadays, it's getting very difficult because everyone, like the doctors with the GMC registration, are struggling to find the job. So it's very difficult. Those who don't have the GMC registration will get the interview call. But I think 2 years back or 3 years back, it was not like that. So there were few jobs advertised as, if you don't have a GMC registration, you can still apply for the job if you get selected from the interview, and then trust will be sponsoring the GMC registration. That means trust will send a letter to the GMC, and they will say that this doctor is eligible to practice in the UK, so you can give him the registration. So that's sort of a letter. So I actually came through that route. Although I was in the middle of the MRCP, I was in the middle of a PLAB. I started long back, but due to the COVID and everything got delayed. Now, after coming here, definitely, I completely agree with Nawrin Apu, the way she actually completed the alternative competency. I went through the similar pathway. I completed the alternative competency, although I initially applied for an IMT training, which I got in 2023, but I thought I'm in middle of the MRCP. I preferred to be just to go for directly ST4 training rather than completing the 3 years training. So I declined that and completed my MRCP afterwards, applied for the training. Now, in terms of the alternative competency form signed, I completely agree to it, Dr. Nawrin Apu. Just two things I want to add. Number one is very important about clinical supervisor and or educational supervisor, whoever you get. They probably will be a consultant level. So first you need to have a meeting with them. In the meeting, first you need to decide whether you are going to are you happy with your clinical supervisor or educational supervisor? So in UK, you have the opinion to express that, yes, the way I am going to do my specialization, whether my supervisor will be able to help me in that regard or not. First, try to explore those things. If you're happy with the supervisor and if your supervisor is happy with you, then your path is quite clear in terms of getting the alternative competency signed. Now, if someone downloads this from the online, you will see that there are hundreds of checklists to be completed for alternative competencies. So it is, to be honest, very difficult to get all those things, go through all those things within 2 or 3 years by not being in training. But it's all about what impression you're creating in front of your clinical supervisor and how is your clinical supervisor or educational supervisor is with you. If they're good, if you're good, if you can make them happy, then they can just sign this form within 3 months or 6 months of starting the NHS job. But if there is any problem, if you feel the problem with educational supervisor or clinical supervisor, or if a clinical supervisor is not happy with you, then I've seen people are struggling to get this signed even in 2 years' time. So it's very important first, who is your educational supervisor, and both of you and your educational supervisor or clinical supervisor are happy with you or not. Yeah.
Yeah, I would resonate with Selim regarding that. Having a good and efficient supervisor, clinical and educational supervisor, is very important to have those signed off or gain whatever you were doing, sir. Yeah. I just wanted to add one thing. I suddenly realized it is given that people are thinking I came here via the MRC period. So that is actually not the case. I started my MRCP, but due to the COVID, things got delayed. And then I finished my PLAB and I started a job with my PLAB route. But I had my MRCP pieces completed, but I started with the PLAB route though, not the MRCP route.
Okay.
Yeah.
Fabulous stuff from both of you. And I'm so sorry. I just assumed because you mentioned MRCP, I thought, okay, then maybe it's the, it's your route. But wow, that's great as well. So follow-up question. If you already had PACES, why did you not pursue GMC registrations through that? And why did you proceed with that?
Right. So that has a little backstory again. So what happened, as I mentioned, I started MRCB part 1 and part 2. Then COVID happened. So that was a long time when PACES, I couldn't get
Right.
PACES. So in the
Okay,
meantime, I
that
did the
makes
PLAB,
sense.
right? So while I just had the result of my PLAB, the
Mm.
same day actually, they gave me an email saying that, well, now we got a seat for PACES. Do you want to give it?
Okay.
So I
Wow.
actually had, like 1 month to prepare for the PACES. Like I was
Wow.
actually UK when they gave me the email, right? So I went back to Bangladesh and then gave the PACES exam and then cleared it. So that's it then. But I already, before the result came in, I had an interview from the area while I did the clinical attachment after doing the PLAB. So I was selected there. So I just like, well, why don't
Okay.
start from the SHO level and then can add to the register level. So that's what I did.
Great. Thank you
Sorry
so
about
much.
the
No,
story.
it's
It's long.
no, that's great. So it's good to know the weird and wonderful and unique experiences because like we don't know, someone might actually benefit from it. So if I may, both of you have some unique things happen like that have happened to you on this journey. So who knows, maybe one of our audiences will have something similar going on and they'll really benefit from it. So yeah, that's amazing that you shared it. Okay, so next question is for most specialities, and if we are talking specifically about medicine, which we are doing today, so we generally focus on type 1 specialities. There are certain specialities like type 2 where you might not need as many experiences or might not need to check as many boxes. But from what I understand, for the type 1 or group 1 specialities, you have to have some ITU experience. So considering, I mean, obviously, Dr. Pinky, you've mentioned that you only worked for maybe a year and a half or something along that line. So How did you manage that? I'm so sorry, you're on mute.
Yeah, I mean, yes, that's right. But my critical care experience didn't come from UK. It came from back home. So I was working in CCU in United Hospital before coming here in UK. So I actually discussed that with my supervisor if he's happy to accept that experience for the critical care experience or not, and he was happy to do that. So that was okay for me. But if someone doesn't have that critical care experience, it's imperative to have a clear understanding what the supervisor wants. If that's what they want, then it's really important to have the IT experience from here. I think that needs to be done.
Okay, great. And did you have to get any specific sign-offs from your CCU department?
Yes. So as I think it's well known that the CC of United Hospital is quite exemplary, and I had a letter from, because I worked there for a long time. I had a letter saying uh, my work pattern was, and that the way I work, the way I handle critically ill patients. So one of my consulate had to write a letter regarding that, certifying that I am capable of uh, dealing with the critically ill patients, which is, I guess, like can say on par with the ITU doctors. So that has to be done before I can apply.
Okay, that is really useful. Thank you. Now to Selim.
Okay, so regarding ITU, you're absolutely correct. So there are few points in the alternative competencies which are a bit difficult to get signed off, and ITU experience is definitely one of them. Because if you're a junior clinical fellow in medicine or clinical fellow in medicine, you definitely don't have the rotation to the ITU, because most of the ITU rotation are being covered by the IMT trainees. So it's very difficult to get a proper rotation in ITU, sometimes in even in acute medicine, which is a mandatory rotation for getting your alternative competencies signed off. Now, as Nawrin said, that she actually got got some cover from the home country, and that helped her. So if someone looks at the alternative competency form, there's basically three tick boxes for the consultant to sign. One is directly supervised, one is he got the evidences from other sources, and one is like he hasn't supervised or he doesn't know about these things. So there are three boxes for the consultant to sign. So if someone has got the experience back in home country, as like Nawrin, then they can give some evidences to the supervisor, and after seeing those evidences, supervisors can straight away tick those boxes. Now, if like me, I didn't have the ITU experience, so how did I do? So what I did is like as a part of my junior clinical fellow rotation in the trust, in my first trust, they actually used to give me some specialty day once in every month, sometimes once in every 2 weeks. So it depends. It used to depend on basically staff availability. So I discussed with my supervisor and my program coordinator that I want to get all those specialty days in a single week, and I just want to spend that single week in the ITU rotation. After that week, during that week, actually, I sent some case-based discussion, like, about the portfolio tickets. I sent some case-based discussion and many cakes to the ITU consultants. I got them signed from them, like 3 or 4 tickets. And then when I went to get signed my alternative competencies, I showed my portfolio that, yes, I did this rotation. And I got it signed off from the ITU consultant. So after that, my consultant was happy that, yes, you've got the experience and you've got the competencies for that. So that's what I actually got my ITU signed off.
Okay, great. So if anyone's here, I suppose that there would be a couple of people here who are not going through a conventional training pathway like IMT, and you are doing an SHO job. It's imperative that you be proactive, because these opportunities probably won't come to you. You will have to plan it, thoroughly, and then get these things signed off for your specialty application. So thank you so much. My second question is in the same vein, and that would be about outpatient or clinic experience. And how did you manage that? I think it can be quite variable if you're working as a clinical fellow in a trust-grade job to get the specific rotations you want, and then the off days or self-directed training also varies from one trust to another. So how to optimize your chances of getting some clinic time? Again, if you could just, yeah, you carry on. Yeah.
Okay, I carry on then. Yeah. Sorry, Nawrin, I'll just start first now. So in terms of the outpatient, in the e-portfolio, if someone looks at the e-portfolio, there are some OP cats. Now, the same thing, you need to send some OP cats to your to the consultant who you are actually doing the clinic with. Now, how will you manage to do the clinic with them? Um, ITU rotation was a bit difficult for me, but getting a clinic time was not that much difficult because most of the time in the afternoon time gets a bit less busier. So if I've got adequate staffing covered in the afternoon time, you can just let your team know or ward team know or of the ward consultant know that I just want to have some clinic time with this specialty or that specialty for my portfolio. I think most of the consultant or most of the teams are very considerate if you approach like that, and they understand about what you're going to do. So they normally accept those things. So you get the time off in the afternoon and go for the clinic. You don't need to send hundreds of the OP cat. I think 4 or 5 OP cats just to show that you are actually capable of managing patients in an outpatient. So yeah, manage your time in the afternoon. Probably once in every month will probably give you at least 4 to 5 tickets. So beforehand, before going to the clinic, you can just select or pick one consultant whom do you want to do clinic with, send them an email, and if you can just meet them in person and tell them your reason that you are actually going to come to his clinic or her clinic for this reason and these things you need from them. Most of the consultants are very, very happy to do that for you.
Great.
Yeah,
And Dr.
I do
Pinky.
resonate with Selim regarding that. I also work like that. I just would add that I used some of my study leave days for as the clinic days, so that I don't use the normal days. And I wanted to completely invested on those days. So I used my study leave days to get that OPCAT signed off. Yeah, but the other things I resonate with Selim. I did the way that he did.
Okay, great. Thank you. So if you have very supportive supervisors, that would make your life easier. But even if, life gets in the way, you will find some other ways, like using your study leaves or annual leaves to get those signed off. So that's the take-home message for this. The next bit of the conversation would be about presentations, posters, and publications. So, Dr. Pinky, if we start with you again, about your experience, which journals did you? So I don't want to use the word target, but I don't have any good scenario at the moment. So yeah, which ones did you target? How did you prepare yourself? Was it a group effort or did you do it
Hmm.
yourself?
I think my scenario would be a bit different because, as I mentioned before, even coming to UK, I had a master's done and I had a publication and international poster as well. So I already had those portfolio before even I started. So I didn't have to do anything for that. But I think there was various. But I did lead the audit. But sorry, I can't really help you regarding how people do this in UK because I already had those points before coming here. I think Selim might help regarding that.
Okay, all right, that's fine. Thank you, though. Your experience is also useful for some of the people who already have a master's, maybe MPH from back home.
Yeah, any points count, so they can show them that for the higher specialty training.
Cool,
Just
thank you.
like I did. Just like I did.
Okay, yeah.
And in terms of my experience regarding the presentations and publications, to be honest, I also can't help much in this regard because I was basically struggling to get my paces completed. You know, that's a very hard exam. Particularly it was for me very hard exam. So I struggled to clear that exam. So my intention was, after I clear my exam, I will go for the national presentation, publications, and all those things. And since I came into May 2022, I was very busy. My daughter was born here. She was very small, and is still very small, to be honest. So I was very busy for the last 2 years, so I couldn't manage to get time to get those things sorted. But my plan was to complete the paces first and to go for. So the time I actually applied for this ST4 training, I didn't actually thought that without publication and presentation, I would get the training number. But to be honest, my message, I can't really help you like how do you publish or how do you present. I can't really help you in that regard directly. But what my message is, some people thinks that publications, presentations are a mandatory thing to get into ST4 training. Um, I don't think it's completely true, because I applied for three specialties and I actually got three of them, a training number in three of those specialties. So if I can do without the publication and presentation, everyone can do. But definitely, if you have got a publication in a PubMed cited journal, if you have got a national presentation or international presentation, if you have got an MSc or PhD, that will definitely add a lot of marks when you are applying, especially in the competitive specialties. Yeah, that's the best I can tell you in this regard.
That's really refreshing to hear, I think, for a good number of people on the audience, especially probably people who are not in the UK, because I think if you are in the UK, if you've been here for a couple of years, things might be easier for you to be, involved in an audit. And you can, even if you present it at a local departmental meeting, you'll get a few points. But people who are on a different health system. For example, I'm from Bangladesh. So in Bangladesh, things can be, publications and everything can be very long-winded. It takes so much time. And so I think the take-home message is, if you've got other boxes ticked, take your chances for the specialty training, because at the end of the day, the application, yes, it's very important for shortlisting, but more importantly, I think it's important to remember that the interview itself carries, I think, 80% of the score. So just focusing on your specialities, interview structure, and preparing yourself accordingly would be key. Even if you don't have so many points in your application scoring, don't feel disheartened, don't lack confidence just because you don't have, maybe 80% mark in your application scoring. But of course, again, at the end of the day, if you have any scope, for example, Dr. Pinky shared that for acute medicine, she presented her audit, if I'm not misquoting her. So she presented her audit in Samba, which is sort of the biggest national level conference of acute internal medicine in the UK. So if you get a chance, take it. Yeah.
Ima, I would like to correct it a bit.
Yes,
So
please.
Samba,
Yeah.
I didn't present my audit there. So Samba is
Okay.
actually like a national audit.
Mhm.
This is
Okay.
actually done by the Society of Acute
Oh,
Medicine.
yeah. Okay.
And you have certain days where each
Mm,
hospital from UK participate, and from
okay.
each hospital they have a leader who
Yeah.
leads the audit. So I was
Okay.
one of that. So
Okay.
that's how I participated in Samba National Samba audit.
Okay. Thank you so much. So yeah, I knew that I was almost misquoting you, but at least it's in the
Almost
same
there.
area.
Almost there.
Yeah, almost there. But thanks for the clarification. So yeah, I think again, it's Society of Acute Medicine. It's the biggest, I think, body of acute international medicine. Sorry,
Yeah,
acute internal medicine in the UK, isn't it?
yeah.
Yeah. So
But I just would like to say that's the audit, Samba audit, it comes in the audit part. It doesn't
mm,
really like recognize
ha-
itself as the poster presentation in that
okay.
part. But it gives you a huge point while
Mhm.
giving the interview, to be honest.
Okay,
If anyone
okay.
is thinking about joining acute medicine, might think
Mhm.
about leading a samba in their hospital, it will be a huge point for you.
Okay. Fabulous. I think
And
someone sent
Ima,
yes, yes,
sorry,
please go
just
on.
to add one thing about the audits and quality improvement project. So yes, I didn't do the publication and presentation, but by that time I actually applied. I had a two complete audit cycle done, like a full quality improvement project, two quality improvement project. So one advice who are listener here and who hasn't started any audit or quality improvement project, my advice to them, yeah, I will stick to the first advice still. Um, Build a good relationship with your clinical supervisor or educational supervisor, and don't think about what audit or what quality improvement project you're starting with. A lot of time when you see the quality improvement project videos, NHS guidelines or NHS quality improvement project team, they will say that think about the full plan and take your time and thinking on those things. What my suggestion will be, don't think too much or don't give too much time about that, then you will never be able to start any audits or any quality improvement project. What I would say, if you're thinking of doing an audit, just pick a topic today, start the audit, and it will eventually be completed. It doesn't matter what quality of audit you are actually doing, it is only about the tick boxes. So if you complete the full quality improvement project, you will get the full marks. It doesn't matter what topic you have chosen. But if you start thinking and if you start think too much, then definitely it will get delayed, and you probably will. I mean, by the time of next round of application, you will not be able to complete it. So try to start as soon as possible. Try to finish as soon as possible. Whatever it takes, whatever small audit or whatever significant the audit is, you just need to get your marks for applying. So that's it. That's my suggestion.
Lovely. Yeah, couldn't agree more. And just in that vein again, I think it probably doesn't even have to be a clinical topic. For example, I know audits like 2 cycle quality improvement projects that were published actually, which was conducted on the effective night shift on doctors, resident doctors. So you can even choose a topic like that, or like waking up
Exactly.
patients 2 o'clock in the morning to record their observations on the
Exactly.
effect on their sleep. Yeah, you can just pick anything
Anything.
as
Yeah.
long as you get the tick box sign. Yeah.
Yeah.
Thank you. I'm just going to take a quick question from the audience. Shushmita has written in the chat box. Her question was about research during MBBS. So I think you've gotten the answer that there's no one size fits all. If you want, it's definitely not necessary to have a research project or have a publication whilst you're doing your MBBS or even after it. It's always encouraged, but it is not mandatory by any means. And the second question is if it's possible to complete both parts of MRCP but still not be granted GMC registration. Um, I think if you could clarify again in the chat box what you mean by both parts. Do you mean MRCP part 1 and 2 or part 1, part 2 paces? Then we can get back to your question. Thank you very much for your questions again. Back to the application, and I think this is sort of the last bit I want to touch on the application scoring. So teaching experience and training in teaching. What's your experience with teaching, if you have any? And if you do, how did you manage it with a very busy schedule and then a busy personal life, I would assume? How did you manage that?
Okay. Not
Sorry, I
Please
should have
carry on.
clarified. Yeah. Yeah. Please carry on, Selim. Right.
okay. So in terms of the training in teaching, I'll first start with the training in teaching. So there were a few online courses. They previously used to accept those courses. Like one is from the Future Learn. There are a few teaching courses from there, and those were completely free. I actually did one of those courses, and I put that certificate during my application, and they granted it for the training in teaching. But recently, I have been hearing that they are not accepting those online trainings or online teachings, which are actually free. I'm not sure about the recent applications, but from my experience, they actually accepted my one, which is like free course on teaching from the Future Learn and combined with the British Council. Now, if they don't accept it anymore, there are few teaching courses. I think, Ima, you know about that. There are few courses in Cambridge. There are few courses in Oxford Medical Training. Those are teaching courses, but they cost a bit, like probably 350 to 400 pounds. Now, I know, I mean, even if you're a trust grade doctor, there are some study budgets allocated for you, and often we forget to take those budgets. So I think it's very important that you plan ahead that where you are going to spend those budgets. You've got to 500, at least 500 study budgets in every trusted doctor. And in some it's 1,000, 1,500 as well, if I'm not wrong. But if you've got a 500, then you can spend on a training in teaching in 1 year. So, and that will give you a full marks in the training in teaching. In terms of the teaching experiences, I didn't have any formal teaching experience. So I actually didn't have any like 3 months. There are few boxes. If you go to the look at the teaching experience boxes, there are few boxes. So the most mark you will get if you can coordinate a complete teaching program for either post graduation or undergraduate medical student here for 3 months, then you will get a full mark from there. But as I earlier mentioned, that I actually didn't think much about scoring in these things before applying, so I didn't plan for those things. So I actually had a few presentations and teaching sessions, like formal teaching sessions in the department. So I got a few marks from those teaching sessions in the local teaching sessions in the department. But yes, it's not very hard or difficult to organize a teaching session. For example, when I was a transcript registrar in geriatric medicine, I had the opportunity to coordinate the full departmental teaching program in geriatric medicine for total of 6 months. To be honest, I was very eager to hand over these things to my junior doctors and whoever it is, whoever wants to take it, basically. Actually, I did see that nobody wants to take it. And if you could have taken this opportunity, if anybody could have taken this opportunity, they could have claimed points in the higher specialty training. So at the end, when I left the trust, actually, there were two very efficient IMT trainee. They took that opportunity, and I've told them that once you finish that, you get a certificate signed off by the geriatric medicine director, and you can easily put the certificates or letter to get the full marks. So it's not very difficult. Just try to find the opportunity. One thing is that you will get every opportunities is in NHS. Just you need to be explore a bit, and you need to ask questions to everyone, and don't be shy. So yeah, I mean, it's very difficult, and it's very easy, and it's very doable to get full marks in teaching.
That's a gem of an advice. Yeah, Dr. Pinky.
So yes, as Selim said, but I'd say that what I did was that, of course, I did some teaching sessions where I taught, like in a weekend teaching session or in a weekday geriatric teaching session. I taught some of those sessions. But I think the most effective was, and to get the full marks, was that I was a part of the organizing team, which actually did every weekend teaching for a certain period of time, 6 months or a year. So if someone that those kind of things, like if they're organizing that kind of thing for a certain period of time, that would give a very good point on the CV or resume when you're applying for the higher specialty training. Yeah. And regarding the certificate, so I think apart from the courses that you mentioned, there are some other website as well, like such as teach the teacher course. I think that is my husband is going to do soon. So I think someone can look into that as well. That might help them as well.
Again, amazing. Thank you. Thank you very much. I just want to share very quickly my experience, and if anyone joins the Cambridge University Trusts, or specifically Edinburgh's under Cambridge University Hospitals, as a clinical fellow or an IMT, there's a cheeky opportunity that you can there's a cheeky opportunity that you can take advantage of. So there's a program that runs parallelly with, your job as a trust rate doctor, which is a undergraduate clinical supervisor. And this is like a separate employment, if you will. And you're directly employed by the University of Cambridge or the School of Clinical Medicine of University of Cambridge. And this involves weekly teaching, just 1 hour a week, and you can choose which year of medical students you want to teach. And a perk that comes with that is you get a fully funded chance to participate in a training called IFME, which is Integrated Foundation on Medical Education. So you don't need to remember the name, but just remember that you will get funding for this, and this leads to Associate Fellowship of Higher Education Academy in England. So this will give you some marks. So you can, if you present it well in your application, you can probably get full marks in teaching and some marks in teaching training. So that's something to think about. And then if you stay there for a long time, you can get a fully funded PG cert as well. And I think for clinical teaching fellows, they get a very good amount of funding for certain courses. So taking advantage of that and doing a PG cert sounds very reasonable to me. So you can look into that. Yeah. Thank you. So now moving on to the most important bit of today's session, how to crack the interview and become successful, as you guys have been in two very promising and competitive medical specialities. So I think the overall structure of the interview is that you have a portfolio section or your suitability to the speciality, and then you have a station on a clinical scenario, and then sort of an ethical scenario, and lastly, a management scenario where you prove yourself worthy to be a medreg, to be to be at the beck and call of every speciality in the hospital. So how to maximize your chances of scoring in the interview sessions. So let's again go to Dr. Pinky first, and we'll come back to Selim later.
Right. Well, for actually, if I only give you my experience, it wouldn't be optimum, because I was actually pregnant with my second child while I gave the interview, and I was quite sick. However, I could give a like general idea about how I prepared, or how one should prepare. Actually, what I tried to, but couldn't do perfectly. So I think the first thing that is very helpful is just to ask questions from whoever had given the interviews before. It doesn't have to be the same specialty. Like, I asked questions from my friends who had given interviews for rheumatology. Yeah. So just ask question, what were the questions and how did you carry yourself? What answer did you give? How did you give it? And did they accept it? What was the feedback? So ask those kind of questions. I think when you hear from a person who is actually went through that sort of experience, give you a better understanding or better overview of actually what's the interview is about, what are the interviewer are asking. Yeah. So find as many as people you can who has actually appeared in the interview, and ask them what they did, what was their feedback here. So that is very important. And the other thing I would say is that in the interview session is that um, being honest, um, because I think sometimes they ask some people question, what is your imperfection, what you're not good at, and we think that acknowledging our mistakes, our fault, will give us a negative feedback, but it's not that. If you show them that you made a mistake and you reflected on it, now you're better for it. If you're honest and you show them the total picture, I think that carries a very good impression on them as well. That was one part of the interview that I wanted to focus on, and that, yes, and the third part is, yeah, just practice in front of the mirror, practice with your fellow colleagues whenever you get a chance. Practice makes a man perfect. So I think practice is very important for that as well. Yeah, and don't ever you lose hope. There's always hope. Yeah, so I think that's from me.
That's lovely. Thank you. And now back to Selim.
Yeah, can't agree more with Nawrin Appu. So basically, whatever she said, that's actually the full story of a successful interview. What I would like to add more, try to apply for more and more specialties when there's job circular for ST4 training. The reason I'm telling you that, whoever is giving the first interview in the ST4 training, he will not have a previous exposure to that interview. But if you actually apply for 4 specialties, and if you get selected for interview for 3 out of the 4 specialties, or if you apply for 3 specialties and get 3 out of 3 specialties, which happened actually with me, then you probably will have 3 separate interview dates. And from my experience, what I tell you, my first interview was for general medicine and stroke, the specialty which I am actually doing now. And the second was the acute medicine. And the third one was geriatric medicine. Now, the first interview, my interview experience was bad. Second interview, the experience was a bit better than the previous one. And the last one, which was for the geriatric medicine interview, that was a fabulous interview. Actually, there was no flaws. I myself didn't find any flaws after thinking about what I did wrong. Well, I did nothing wrong in the geriatric medicine interview. That was probably partly I was a geriatric medicine registrar, and partly because of my previous 2 interviews. I knew that what questions they're going to ask, how they're going to ask this question, and what are they expecting as a next question, or what are they going to tell as a next question. So that actually happened. That actually gave me a lot of confidence when I was going to attend the geriatric medicine interview. And my position in geriatric medicine ranking was much higher than these 2. So what I advise is try to apply as many as a specialty, even if you're confirmed that you are not going to join those specialties. I would say apply only because you get experience, like real-time experience, real-time interview experience with ST4 interviewers. The other thing is there are a lot of resources online, lot of online coaching, online coachings or courses. You can obviously follow those things. To be honest, in terms of the clinical scenario, nobody will be able to tell you that what you are going to get in the clinical scenario situation. But for other ethical and competency as a specialty trainee registrar, these are very, very fixed question. Probably 10 to 15 fixed question. You prepare those 10 to 15 fixed question very thoroughly. Practice it in front of the mirror, and go back to your first year medical school. Try to have a partner for practicing with those. That helps the most. And for those 2 things, that will help. And for the clinical scenario, it's mostly about the experience. And if you're working in an NHS setting, you know that what actually they do when there is an acute setting comes. For example, anyone becoming unwell, what we do is like, we need to do the ECG, we need to do the chest X-ray, we need to do the full bloods. So if you're in an NHS setting, just tell those things. Even if you don't know the diagnosis, just tell them your approach, that you are going to approach in this way. Then they will lead you to the diagnosis, because definitely we don't diagnose here on the basis of only clinical symptoms. Definitely they will give something to give the diagnosis. So clinical experience, then practice, and then try to apply for as many as the specialties you can to get some real-time experiences with interviewers.
Gosh, that is absolutely brilliant. I'm definitely stealing this idea for my ST4 application when the time comes. Thank you so much. And in the same vein, I was actually going to ask about mock interviews. So you've sort of covered that. So probably the best sort of experience to go through would be other interviews in a standard setting for ST4 So we can all use that. Are there any particular resources that you use for preparing yourself for the clinical scenarios or the ethical or sort of management scenarios or the 10, 15 questions that you talked about? And again, disclaimer, we're not sponsored by any, third parties. It's just what we may have used in our very own personal experiences. Yeah.
If I say I actually used an online resource, but I'm feeling ashamed to say that I forgot the name of that online resource.
That's
Probably
okay.
SP4 interviews or something like that. The most
Mm.
common that everyone picks up. I actually
Mm.
I actually subscribed that one with some probably 120 pounds. I forgot actually the money because and to be honest, I could not give much time to prep for the interview because I told that
Mm.
I just finished my MRCP PACES exam, and then
Mm.
I got the interview call and everything. So I didn't actually get much time to prep. But yeah, I think this is the most commonest online. If someone write it down, what resources to follow to prep for the ST4 interviews, this probably will come at the top. And I actually followed that one. Probably it's ST4 interviews app, something like that.
Okay, no, that's still helpful. We can go to Google and Gemini to help us with that. Was there anything specific you used for a stroke or general medicine and stroke, or was it just standard practice?
Well, so during the stroke interviews, to be honest, I was doing my stroke rotation. That helped me a
Uh,
lot. I whatever I did in the morning, I just told them in the afternoon that I will do this thing. So it actually helped
wow.
me.
Oh,
And
wow. Okay, great. So at the end of the day, it always comes back to your clinical experience in a way. Thank you. So, Dr. Pinky, how about you?
So I bought a book. I bought a book to help me prepare. I couldn't finish it properly because of the mentioned reason. I think the book was called Medical Interviews. It's a very common book. I think it's IPFT or from some sort of like publication from that, but it's a very common. I think that's the book that is followed by all the people who were giving interviews for SHO or register. That book, like everyone reads that book. Sorry, I can't remember the name. I bought that book. But I think the other two resources that I would share, which much helpful to me, was for the clinical bit. I read
Mm.
or just revised a bit the Oxford Handbook of Clinical Medicine. So that
Mm.
helped me, and just took a bit or had a light reading on Oxford Handbook of Acute Medicine as well. So those two
Mm.
resources, I actually that was pretty helpful. And I would also say whoever is giving ST4 interview, to go through your your specialties curriculum. What are the curriculum? Because
Mm.
when you are giving the interview, if you say something from the curriculum, or if you say that you're interested in that bit of the curriculum that attracted your attention, just to let them know that you have you're aware about the curriculum. It carries great mark. And the other part is you should also know about the GMC's good medical practice. Uh,
Mm.
the points from there, if you integrate in your interview answers, that also helps you carry good marks. So yeah, that's it. Just curriculum from your respected specialty and the GMC good medical practice, apart from the book that I mentioned, that would help you prepare.
Fabulous.
I
Thank you.
am
Yeah.
just sorry to interrupt. I just got I just went through my email and so yeah,
Oh,
the
thank
resource,
you.
yeah, the resource I actually followed is like optimize interviews. So yeah, it was the only thing probably I followed before my interview. But definitely I prepped my own notes and from them because whatever there are some videos in that resources and that's their language they're using. So definitely
Mm.
I will not be able to use their language. So I put my own notes and put my own language before the interviews. That was the only probably job I did.
Oh, cool. That's great. Thank you. Thank you both ever so much. We are approaching almost the end of our session. So I'll go back to our respected guests for the ending remarks, and then we'll try and take questions from the audience. So this is sort of goodbye from me. I'll go back to Dr. Pinky to share your ending remarks, and if you have any particular advice or anything in particular you want us to remember for ST4.
Right. I would like to thank you all who has been listening or will listen in the future. It's been a great opportunity, and thank to all the organizer for inviting me to have my say in here. And what would I like to say to the people who are aspiring to appearing in the interview or applying for the specialty interview is that don't ever lose hope. If I understand that sometimes it feels really difficult, it feels really challenging, but if you are just persistent and there's always light at the end of the tunnel. So just hang in there. That I would say. Yeah. Thank you.
Before I'm going to say anything, I think I'm seeing a few messages. I'm not sure, Ima, are you seeing these messages?
Yeah, I'm seeing these messages. So after your remarks, we'll go back to these questions and try and answer them.
Okay. All right, that's
Thank
fine.
you, though.
Okay, so yeah, first of all, I'd like to thank the DMC Club UK to organize this podcast, and that's definitely a bit inspiring for us because we're a guest, and to be honest, you mentioned about honorable guests, so I feel very much proud and very much pleased about that, and thank you to DMC Club UK for giving us those opportunity. Number two is a special thanks to Dr. Atikur Rahman Bhai, who's actually taking all these pains to organize every week. And also thanks to all our listeners and whoever is watching these in the live situation or will be watching remotely once the show is finished. Thanks to all those listeners, and that will inspire and that will keep inspiring us. And finally, I'd like to thank you, Ima. You had been very nice and you had been a brilliant organizer since the start. So thank you.
That's very kind of you. Thank you so much, both of you, for being so kind and so helpful. Thank you.
I just saw a question in the chat box. I'm not sure who's going to take that. So,
Yeah, sure. So the question is from a junior colleague to be, Shushmita. She's a third-year medical student now. Her question is, what should I do as a third-year medical student if I want to establish myself in a foreign country like the UK or Australia or Canada as a practicing doctor? So basically, probably in a clinical scenario, rather than maybe an academic one. And that's within 2 years of completing my internship. Very, very good question, but also very difficult to answer, probably. Yeah, go on.
Now, as a third year student, thanks to the third year student whoever asked, I'm probably I don't know her or him, but first of all, I'd like to thank that she or he started thinking it from the third year. Often what happens is after finishing the fifth year, we started thinking about whether we will go for the BCS or we will go for UK or USA or Australia or Canada, which will be better for me. So she's started thinking from the third year, and that's very, very inspiring. Now, my next line will be, whatever you're thinking as a third year medical student, everything is doable for you. So if you want to go to USA, you can do that. If you want to go for UK, you can do that. If you want to go for Australia, you can do that. So don't think or don't question about your competencies. So now, first you fix which country do you want to go. If you want to come to UK, welcome. If you want to go to Australia or Canada, there are separate pathways. Now, after selecting this thing, like if you want to come to the UK, just take a piece of paper or in the smartphone, just try to note down what are the tasks from now you need to do to go to the UK. A lot of people will say that first finish the internship, first finish the MBBS, then you can think about that. MBBS, as a student, you have entered to the MBBS, you will definitely finish that. There is no question about that. If you're a third year student thinking about going to abroad, then definitely it will be a like piece of cake for you to complete the finishing the MBBS. So don't listen to them. You have started thinking, continue to think about that. Take a piece of paper, make a flowchart. I am going to move to UK. So these are my things to do. um, I will start with language test, I will start with PLAB, or I will start with MRCP, whatever you think. Like, you make a flowchart. Then we call it a SMART approach, like specific, measurable, achievable, and time specifics. Like within how many days you can do that. Definitely there will be a lot of ups and downs. There will be a lot of disappointment. I hope you will not, but a lot of it happened with me. I failed a lot of exams and everything. So it will ultimately probably will delay something. But if you're thinking, if you're starting from now, you can be very quicker than anyone else. So you think about that, and hopefully you will end up to your preferred destination. Now, one thing, never do, don't try to go for both the countries. Like, don't try to sort for the exams for UK, Australia, or USA at the same time. Choose only one country and go for that. If you Even if you get USMLE done, even if you get USMLE PLAB both done, you will be ultimately ending up in either UK or USA. You will not be able to do the jobs in both the countries. So be very specific, like which country you want to go, where do you want to go, and what do you want to do. So be very specific, and definitely everything is doable for you.
Wonderful, amazing. Thank you very much. Dr. Pinky, do you want to add anything?
I think I resonate with Selim, and I would say that yeah, just choose one country, stick to that instead of like trying for the different ones. That will make your life much easier and your end journey more feasible as well.
Thank you. Thank you very much. To our audience, do you have any more questions at all? You can unmute yourself and ask the question, or as always, you can write on the chat box. We'll wait for 30 seconds. If not, then we will wrap up our session today.
Yes.
I think
Ima,
Salma, do you want to say something?
sorry,
Yeah.
go ahead, Selim. Yeah,
Sorry. Yes, there is another questions in chat box. I'm not sure whether you're
yeah,
seeing
at the
that.
center.
Yeah.
I
MD
didn't to say
Shahbaz
about
had
that.
in this question. He mentioned that, sorry if I have missed this and it has been mentioned or not, regarding the tick box for 500 acute medical cases. How do I show evidence to the consultant signing it off? Do I need to have 500 reflective case entries in the portfolio? Um, the thing is that it's very difficult to do 500 reflection in your portfolio, and it's probably will be impossible for me. So there are two options. One option is to discuss with your clinical supervisor or educational supervisor, like how they want to do it. Most of the time they will say that if you're working in general medicine, or if you're working in acute medicine for this much time, definitely you will have seen those 500, so I don't need any evidences for that. So that's one. Number two is, sometimes they are a bit strict about these things, so what they prefer is you maintain a logbook. Now, what a logbook is, it's nothing rocket science. You can just maintain an Excel sheet. In the Excel sheet, you can just just simply put the patient's complaint, patient's gender, and what was the final diagnosis. Like those patients you have seen today. So every day, probably we see 5 or 6 patients, or probably 2 to 3 new patients. So by the end of like 6 or 7 months, you will definitely have a more than 500 patients in your that logbook. So sometimes they prefer these things. Like if you maintain an Excel sheet or logbook, you can just at the end, during the get it signed off, you can just present it to them, and they can obviously sign it for you. So that's how you don't have to do the 500 reflective cases, and that's very, very difficult.
Can I just add to that note is that there is a file called FART calculator which you can download from GRCPTV portfolio, GRCPTV site. So that is you can use to use as a logbook or the Excel sheet to put all the entries for all your patients that Selim mentioned about. And the other thing that can be done is that you can have a self reflective input on your e-portfolio, mentioning that you have been working in acute medicine or general medicine for that much days. You have been doing on-calls for that long time, and you have seen more than like 500 patients. You have encountered that many patients. So you could have write something like that in your portfolio as well, apart from maintaining that logbook. I hope that answers your question.
Yeah, I think it did because our audience kindly thanked both of you. So thank you again, both of you, for taking this question. And since there aren't any more questions, we will wrap up today's session. And again, thank you both ever so much for spending this lovely sunny Saturday afternoon with us. And congratulations for having some or securing two of the very sought after medical specialities, and all the best with the rest of your journey in your medical career path.
Thank you. And
Thank you very much.
thanks again for inviting us.
Thank you so
Thank
much.
you, Ima.
For the audience, you can find this session or refer back to this session on DMC Club UK's Facebook page and their YouTube channel as well. And you'll find other resources for in case you're exploring other specialities like general surgery or urology or other surgical specialities. So stay with us. And last but not least, thanks to DMC Club UK and Dr. Atikur Rahman for organizing and working very hard to get our guests and managing everyone's schedule and getting this Metamorphosis Medcast going. Thank you all. Take care. Bye-bye.
Thank you, everyone. Thank you, Nawrin. Thank you, Ima. Thanks to DMC Club UK. Thanks.